Hi, my name is Miles McGann. I'm the president of McGann Postgraduate School of Dentistry. In my daily work, I work with dentists from all over the world that work in both large offices and small. One thing that I've heard stories of, especially from mature dentists, is that they realize how many treatment opportunities they miss because of improper diagnosis, and especially not thorough diagnosis. As a result of this, I've created our new aesthetic series to try to teach dentists from all over the world how to best diagnose their patients, looking at every aspect of dentistry, where it falls in, and coming up with a roadmap for those treatments from the very beginning. So our course is going to cover a wide variety of specialties, from occlusion to ortho to implants, and finally with the aesthetic aspects of it. And by putting everything together in one long series, you can actually understand where everything fits in and how to best present these treatment alternatives to your patients. We're going to start the class off with a heavy dose of diagnosis. The idea being that with a checklist type environment, you will look at every patient and understand every aspect that you want to offer to that patient and make sure that you aren't missing some key component that's going to make that patient look better. We're going to go through each one, and as you're going through the checklist, you'll be looking at every area of it. If the patient has a perio problem, what are your alternatives and how do you get that fixed? And where does that fit in next to ortho or next to implants or when do you do your finishing? We're going to put all this together so you can, when you're in front of a patient, present a total plan for the next 10 years or whatever is needed in that patient to give them the perfect finish at the end of the day. The advantages of doing it in this method is that your patients will trust you much more. You know, in this company we talk a lot about not being a salesman, but instead being an advocate of the patient. If you're in there trying to sell each individual treatment without putting it into context, eventually your patient thinks you're just trying to make money off of them. But if you come with a total plan and show them that the advantage of doing it in each way, you now are taking the position, the side of the patient, where they feel like you're their advocate and you're trying to help them, not just trying to take their money. This also will bring patient loyalty because patients understand that you are trying to help them, and they will tell their friends about, you know, this dentist over there that's trying to make their life better and trying to improve the way that they look. The other major side of this from your point of view is that this will increase your revenue. You know, finding patients today in this competitive marketplace is very difficult. Offices spend a lot of money on marketing and other ways of getting new patients into their practice. In order to be the most successful dentist around, it's not about how many patients you bring in, but how much revenue and services you can generate from each one of those patients. If you're only doing cleanings and doing examinations, your practice is probably struggling. But the more things you can do on those patients, the more revenue and the more profit your office is going to generate. For all these reasons, I really feel like this aesthetic class will really help your practice. It's a very unique program that I haven't seen anywhere else in the world, and I hope to see you there soon. Thank you.